Y or V laceration matress sutures are effective in preventing necrosis of the tip of the flap. In a laceration such as this, where there is a Y formation, one is tempted to insert the needle through the tip and then through one side of the laceration. The problem with this is the very tenuous blood vessels at the very end of this flap will be compromised because of the pressure applied by the tied suture. To prevent this, we use the Y or V laceration matress suture. And this is a very handy procedure. You enter on one side of the base of the V or Y. You then subcutaneously traverse and then exit directly opposite on the other wound margin. Now, as you can see, that can be performed with just one motion. When this is tied, there is no pressure on the blood vessels at the tip because the actual tip is not involved, only the subcutaneous tissue. And this ends up with an excellent closure also. Figure of 8 suturing is excellent for scalp lacerations when there's bleeding because the blood vessel that is bleeding has pressure applied by the figure of 8 suture, and it's applied like this. You enter on one side of the wound, exit at an angle on the opposite side, not directly across, and then you re-enter directly across from the original insertion and cross over, exiting across from the second area here. So what you've created is a figure of 8. When this is sutured, you end up with some degree of eversion plus pressure on a vessel inside, and frequently that is all you need to prevent scalp bleeding, rather than trying to find the small vessel and tie it off. A slipknot is a very effective suture, especially with young children. The sutures can be removed without having to come at the child with instruments, especially a blade or an iris scissors and a forceps. You're able to remove it simply by removing the proxy strip or steri-strip, grasping the end of the suture and pulling it. And it's inserted identically to a simple skin suture. The only difference is that after the 2 turns, instead of grabbing the end of the suture material, you grab it in the middle, resulting in a small loop like this. Each time you tie it, you grab the loop instead of the end. After 4 ties, you then cut the end connected to the needle and cut that quite short so you'll know the difference. To prevent the child from removing this, one piece of steri-strip or proxy strip is very effective. When it's time to remove it, you simply grasp the long end with your fingers and it comes out. Although the tension or the tensile strength prior to removal is the same as a regular simple suture. Subcuticular sutures are excellent